Hi, I'm Dr. Scott St. Amour,
And I'm Dr. George Rogu. We're both from RBK Pediatrics and Urgent Care.
and we just wanted to make this video to welcome you to the practice, let you know what to expect from us and what to expect at your first visit with your newborn. So first, congratulations. Just a couple things to know about our practice. Firstly, we are always around. Anytime you need anything, all you got to do is give us a call. Our offices in Comac and Bayshore are open until at least 8 o'clock every night for walk-ins and urgent care. And we have doctors on call 24 hours a day. You can call us at any time. You are never alone.
And we're also open on Saturdays, Sundays, and holidays.
We have modern medical facilities. We are an NCQA certified level 3 patient-centered medical home and provide full urgent care services for all of our patients.
The hospitals that we admit to are Good Samaritan Hospital and St. Catherine's of Siena.
So
what to expect there on your first visit? Well, at the first visit, if you're one of the RBK patients, we will see you at the hospital, either at Good Samaritan Hospital or at St. Catherine's Hospital. But if you're not, we don't see you at the hospital, and we'll see you in the office. And at that visit, we'll review your birth history and your hospital stay. So please make sure you bring the appropriate hospital discharge paperwork so we know what the bilirubin level was, we know what the baby's initial birth weight was and discharge weight, and any other important information such as the number of the newborn screen. When you come in, the physician and the nurses, they'll check the child's weight. We'll make sure that the baby is gaining weight appropriately. Many times the babies lose a little bit of weight at the very beginning, the first couple of days, and then they gradually increase in the weight up until they get back to their birth weight by 2 weeks of age. Babies will be breastfeeding, and sometimes they'll be formula feeding, depending on the situation. And we'll examine the child. We'll be very gentle with the child. We'll look for any underlying problems that we may not have been discovered during the newborn examination, and we won't do any unnecessary tests. And of course, as always, we'll answer any questions that you may have. We'll never make you feel rushed.
some of the common things we talk about with newborns. Firstly, nothing is more important than feeding your babies. We recommend feeding every 2 to 3 hours, including overnight. We never recommend waiting longer than 3 hours without providing your baby some formula or breast milk. Remember, babies can drink and sleep at the same time, so even if they fall asleep, they can still keep going there. When we talk about what to feed the babies, breast milk versus formula, remember the most important thing is just getting the calories into the babies. There are no downsides to using either exclusive breast milk or exclusive formula feeding. There are benefits to either or, but no downsides to either of them. Also remember, one of the most important things is we never give the babies anything to eat or drink except for the breast milk or the formula. No water, no cow's milk, no juice, nothing but the breast milk and formula. It is by far the best source of hydration and nutrition for the newborns.
Now, bathe in the baby. During the first week or so of life, as long as the umbilical stump is still there, you should sponge bath the baby, because if you think about it, the babies really don't get all that dirty. Once the umbilical stump falls off, then you can submerge the baby and give the baby a regular bath. But up until that time, just sponge bathe in the baby. Once, twice, every other day is okay. Sometimes the skin is dry, sometimes it peels. That's the normal phenomenon that happens in little babies. If you would like, you can put a little moisturizer, but make sure that there's no dyes or fragrances, and you can use as much as you desire.
When it comes to caring for the umbilical cord, you don't need to do anything special for it. We don't recommend cleaning the cord itself or anything inside the belly button. You just have to dab around the cord area with a little bit of water. The cord itself should fall off after a week or 2. If it falls off and you see anything under there red and glistening or white and glistening, give us a call and we can take care of that for you. The danger signs to look out for the umbilical cord: if the skin around the belly button starts turning red, getting irritated, or if you see any discharge, bring the baby right into the office here for us to check out.
And then if there's any discharge or any problems, we can do what's called umbilical stump cauterization, where we basically take a little silver nitrate stick and touch the oozing part of the umbilical stump, and it dries it up nicely. Now, diaper care. Diaper care is very important because babies will develop diaper rashes if there's stool and urine that sits for a prolonged period of time on the skin. So if you clean off the baby really, really well after they stool with soap and water, and then clean it off, and you can apply some diaper creams on it. Put a good amount of diaper rash cream to make a barrier protection. If you think about it, if you put a barrier between the skin and the irritating substances such as stool and urine, it'll help prevent diaper rashes. Some of the creams that you could use are A&D ointment, triple paste, or Desitin. Taking a baby outside, sometimes parents ask, when can I take my baby outside? I would be very careful about going outside, especially in the first couple of weeks of life, because there's germs outdoors. You don't want to expose the baby to unnecessary an environment of germs where the baby will unnecessarily get sick. And very, very important, you don't need that direct sunlight on the baby to burn because they have very sensitive skin.
Sleeping. We always advise putting the babies in their own cribs to sleep. We never recommend falling asleep with the babies in your arms or in your beds with you, and this is a pure safety issue. We all roll around when we sleep at night. We don't want to be holding the baby when we roll over, drop the baby off the bed, roll over onto the baby. Unfortunately, we do see this. And so we always recommend, whenever you feel like you're falling asleep, always put the baby back into their little crib. Also, make sure that we don't have any loose blankets or anything like that that can present a risk of strangulation for the babies.
Unfortunately, Scott, during my career, I have seen babies that were suffocated while the mother inadvertently fell asleep on top of the baby, and it increased the risk for sudden infant death syndrome. And unfortunately, those babies expired. It doesn't happen often, but it does happen.
We never advise babies sleeping on their bellies for just that reason. Also, expect a very inconsistent sleeping schedule with the babies. They don't care about day and night. They're going to be up, they're going to be asleep. It will start evening itself out after about 3 months. So a little bit of patience and you will get through it. So thank you for taking the time to listen to this video. I hope it helps you out and provides you with a little more information about your babies before you come in to see us. We're looking forward to seeing you, meeting you, and we'll answer any questions that you have when you come on in.